Hughes,
Yo.
Commissioner John Padilla,
Yes.
Commissioner Carla Lopez.
Yes.
Motion passes.
Thank you. We'll move on to the approval of the minutes for April 15th, 2020. Are there any changes from staff?
No changes, Madam Chair.
Any amendments from the commission?
Yes.
Go ahead, Commissioner Lopez.
Carla, you're on mute.
You're muted.
There I am. On the very first page of the executive summary, there's 3 components and they were just numbered wrong.
Oh.
It said there, here's the 3 components and they were numbered 1, 2, 4 or something like that. It's very minor.
Is that in the minutes or the
On the executive summary. Oh, we're on the minutes still.
Yeah.
Sorry. I'm getting ahead of us.
No problem. Just Alex, Willie just texted me and said he was waiting for the host, it says. Okay, so if we don't have any changes to the minutes, what's the pleasure of the commission?
Oh, there he is.
Move to approve.
Second.
Was that a second from, let's see, a motion from
Rosario.
Commissioner Hughes, second from Commissioner Torres?
Yes.
All right. Can I get a roll call?
Chair Renee Villarreal,
Yes.
Commissioner Rosario Torres,
Yes.
Commissioner Ken Hughes,
Yes.
Commissioner John Padilla,
It'll be a yes.
Commissioner Carla Lopez,
Yes.
Commissioner Willie Marcus.
And you're on mute, Commissioner Marquez, just so you know.
Commissioner Marcus, do you want to
Just
vote?
muted more than one way.
Yes.
There we go.
You vote yes.
Yes.
Thank you. Motion passes. Motion
Yes
passes.
for me.
He unmasked
you.
himself.
Thank you.
Gotcha.
So that was, we have approval of the minutes, and we're moving on to item 5, which is request approval for amendment 1 to the 2019 annual action plan describing how CARES Act funding entitled through CDBG will be used to support the city's response to the corona pandemic and related health impacts. Alex, please.
Thank you, Madam Chair and members of the commission. The short version of this amendment is that we are proposing to use the CARES Act funding. So this is in addition to our current year, 2019 current year CDBG grant. The amount is $361,227. And this is basically entitled to us. So all we have to do is describe to HUD how we want to use the funds, submit all of the paperwork, have the regular process that we go through for an action plan with a shortened public comment period. So what we are proposing to do with the funds is to continue the operations of the shelter services at the Midtown campus. So I think all of you are aware that in late February, we realized that the pandemic was going to wreak havoc on our homeless population, which also has broader public health impacts and could lead to a lot of community spread beyond the shelters. And so this city very quickly and nimbly for the city converted some dormitory rooms and some of the campus apartments into housing for people who were either unhoused at the time or medically fragile. We eventually got some residents who were also COVID positive. In the beginning, nobody was, but everybody was screened for symptoms. And it provided a safe place for people to be isolated and to self-quarantine. And we've had, I think it was hugely successful. We know we've had over 100 people stay there. 20% of those people, or 90% of the people were chronically homeless or homeless at the time that they moved in. 20% were medically fragile. I believe we now have about 10% who are COVID positive. So they have low acuity symptoms. They don't need to be on a ventilator, but they need a safe, clean, quiet place to recuperate. So, I think for all intents and purposes, it's been hugely successful. This also means that all of the shelters are able to keep their population density lower so that they're able to observe social distancing within the shelters. So the CARES funding is specific to addressing and offsetting the health impacts from the pandemic. Much of the language talks about hospitals and healthcare settings, but housing is a big piece of that. And so this is, I think, I'm obviously recommending approval of this, but I think there are a couple of reasons why it's such an ideal use of the funds. Most importantly, of course, it meets the intent of them, but also because of what the city's going through on the budget side, this really has the potential to fill a very important gap. So we may be able to continue housing people there with this funding, certainly through the end of the year and possibly up to the point at which we have a vaccine. And not that we want people to go back on the streets, but at least we can bridge that gap with this funding. And I do also want to point out that we're working feverishly with the community services folks and the people currently running the shelter to look at how this can provide a framework for creating a facility, a long-term permanent facility like this, because this is demonstrating, I mean, we all knew this intellectually and the research shows, but we're actually demonstrating it, on a real viable case study here, that when you house people, it is much more easy to get them into services, to get them supported, to get them stabilized. And this is really the way we're going to end homelessness, by housing people. So this, and using the campus obviously is not a long-term option unless, as a result of all the public engagement and the developers' financial performance, it's somehow worked into the master plan. I don't think that's going to happen, but we are very confident that we're creating a framework and a model that can be moved to another location, and most likely not run by the city, but this is another way to build the capacity of our community partners to create that model and sustain that model at another location.
Thank you, Alex, for that introduction and information.
Madam Chair, if I could also just add the proposal, and we will be bringing through all of the city committees and the city council, a contract to work with the New Mexico Coalition on Homelessness, which will provide fiscal agency for the project. That way, if they're hiring the contractor to provide this shelter management and the case management contractors, it's much nimbler and quicker, and we can get it done so much faster than if we were trying to do it internally through the city. We'd have to go through a whole RFP process. So we're trying to just make this happen as quickly as we can. And the New Mexico Coalition on Homelessness, because of what it is, which is truly a coalition of service provider agencies, has kind of the inside scoop into every agency and has a lot of practice administering and monitoring the use of HUD money. So there won't be any surprises when we ask for timesheets and all the kinds of things that HUD wants to see. So, so that's great. And for the CARES Act funding, and only for the CARES Act funding, HUD has removed the 15% public services cap, because this is essentially a public services program. So we can use all of the funding to provide the services and the staffing and some of the auxiliary costs. There's custodial costs and some security costs and just some general related, people need toothpaste and stuff like that. So the funding can address all of those items.
Excellent. Commissioner Torres has a question.
So, Alex, right now the city is managing everything, and then once this is approved, it would be transferred to the coalition. Is that correct?
Commissioner Torres, that's a great question. What we would do is the coalition's role would be to be this fiscal agent. So the actual decision-making would be made by a board of directors. We're calling it a governance board. It would be, the majority would be the current board for the New Mexico Coalition on Homelessness, because those are all representatives from the various member agencies. But we would have a strong city presence as well, so that we can really make sure that all the decisions are being made in the best interest of the city also. But to put in place that framework for what the future operations looks like, it wouldn't necessarily and probably wouldn't likely be turned over to the Coalition on Homelessness. But this 6 months buys us a little time to find the more permanent operator. And it may be one of our current shelters. It may be St. Elizabeth's Shelter or Lifelink, or it may spin off its own organization. We're not really sure, but we felt like with a governance board that was creating some oversight, but it also gives that board a chance to kind of plan what the future looks like while the shelter's operating.
Okay, I have another related kind of question. Would city staff salaries be covered under this amount? And if they are covered, are they subject to the furloughs and the budget cuts and all of that? Or would it be staff from the coalition agencies?
Correct. So we cannot, Commissioner Torres, we cannot cover city staff costs, because then that becomes an administrative cost for us, and we have a limit on how much we can spend on administrative costs. So the new staff that will be brought on and paid for through this grant, they will be contractors. So they will be people under contract who are, the word is escaping me when you're
Temporary?
anyway, well, not temporary, but they're hired to do a project for a certain amount of time. So they go into it knowing it's going to be this long and they're going to earn that much. And so independent
contractors.
Independent contractors, yes.
Commissioner Torres, you still have the floor.
Okay, on page 7 of the report, I have a question as what this sentence means. In paragraph 3, the city CDBG sub-recipients start to coordinate with the Santa Fe Civic Housing Authority so that outreach activities and some programming are located at housing authority sites. What is that?
Commissioner Torres, thank you for bringing that up, because I should have mentioned that at the beginning. The only text that all of you are considering today is the text in blue.
Okay.
This is an amendment to the plan that was written over a year ago. So there's a lot of the black text that I updated and rewrote for next year's action plan, for the 2020 plan. I wasn't going to go back and do that for this amendment. So you only need to look at the blue, the text in blue.
Okay. And I think those are the only questions that I have related to blue. Oh, I know what, on page 31, at the beginning of the paragraph, it says in March of 2019, the state of New Mexico issued a stay at home. 2020.
Yes. Which page was that?
Page 31.
31. Okay, Tony, are you making a note of that? Okay. Yes, no, that's completely wrong. See, I'm in a time warp. Yes. Oh, my goodness. I don't even know what year it is. Okay.
Okay. I think those are the only questions that I have right now.
Sounds good. Thank you for those questions, important questions.
Thank you.
Any other question? Let's see. I saw a bunch. First, let's go with Commissioner Hughes, and then Commissioner Lopez, and then Commissioner Beauty Queen Padilla.
Thank you, Madam Chair. It's not a question, just a comment. I was talking to another department chair yesterday and commented that, or noted that the survey that many Santa Feans responded to, I don't know, hundreds if not thousands of Santa Feans came in and, what are your budget priorities? And service to the homeless was one of the top three. So I think this proposal is certainly in line with the sentiment of the vast majorities of people in Santa Fe.
Definitely a snapshot. The survey had about a little over 4,000 respondents from that live in the city, and that was a priority. The demographics weren't it wasn't representative, but it was a snapshot of what people think, and I think it was helpful. Any other comments or questions, Commissioner Hughes?
No, that's it. Thanks.
Okay, Commissioner Lopez.
Yeah, again, the typo on the executive summary. It's about a little over halfway down the first page where it says there are 3 components and they're just misnumbered. And then I read somewhere, just to follow up with Ken on the survey, that one of the people's big concerns was that counselors and the mayor should have their salaries cut. Maybe somebody should do a pie chart to show people how much you really make, so that was just sort of, for counselors anyway, not going to amount to a whole bunch of money, even if you get cut by 50%.
Right. Well, my suggestion is they shouldn't have lumped those two together because they're diametrically extremely different.
Right. Right. Anyway, I have nothing else. I think it's a great idea. Glad to see the city move so quickly on this and that it's been such a success. Congratulations to you, decision makers. That's all I have.
Thanks, Commissioner Lopez. Commissioner Padilla.
Well, good afternoon. Question for you, Mike. Staying on that page 31 that Commissioner Torres had mentioned, it was the 2019 issue, but in the first paragraph, last sentence that states in blue, another objective was to relieve hospitals by creating a place where vulnerable patients and or those with positive COVID test could be discharged, as well as sheltering people having or leaving detox recovery programs or detention centers. Can you explain how that works into housing the homeless?
Commissioner Padilla, the people who are being discharged from these institutions have no other place to go. So normally they would be going to the shelters.
Okay.
Or they would be staying at the hospital or staying in the institution for longer than they need to because of that. So that's,
okay.
Yeah, that's what that means.
Okay, so when I read it, I didn't read it that way. I read it as basically helping to relieve the hospital of COVID tested patients, not those homeless that had nowhere else to go. So that was the confusion that I had. Thank you for clearing that up. I don't know if that needs to, be in there of some sort stating that it's for that homeless population leaving hospitals, etc. So just a thought there. Did I understand correctly that the city's operation of that Midtown shelter is cost is approximately $1.2 million?
Commissioner Padilla, yes, that is an annual budget number.
Okay, so this 391 or 361 that we are looking at is just a small portion of that pie to handle the operations there. And this can all go to operations.
Mm-hmm.
It doesn't need to be proportioned out or segmented out in any way. It all goes to operations of the Midtown shelter.
Correct.
Okay. Thank you. That's all I have.
On that point, Alex, I know there were folks that they were, what Commissioner Padilla was talking about, discharging and they were sent to the campus, but there were a couple of patients I thought that weren't necessarily homeless, but they wanted to have a place where they could be isolated before they'd actually go home and potentially affect their family members. Was that correct?
Madam Chair, that is correct. Most of those patients were native, so they were from surrounding pueblos and living in multi-generational households, and they didn't want to go back and create the risk of infection.
However, in this case, you may have to specify as it relates to homelessness and people experiencing homelessness in this application versus like what we know as the general support we're providing.
Okay.
Is that right? I'm just clarifying. Like in this
Oh.
application, does it have to be related to homelessness, or did you add that in because we did have people that just needed isolation options?
Madam Chair, the funding is not specific to homeless populations. It's to address
COVID.
public health impacts from COVID. So we're choosing to make most of it about housing homeless people, but we're also helping other people who maybe they're not homeless, but they don't have enough money to pay for a hotel or a safe place to be isolated.
Okay, so in that case, that language will be okay to keep as is. Okay.
Yes, I think so. I mean, you raise an interesting point. The percentage of people who aren't homeless, though, has been really minimal.
Right.
And apparently one of the people showed up with some family members and said, okay, we're ready to stay here while I isolate. And so they had to say, well, that's kind of not how it works. And so she opted not to stay there. So, you know, we're just making it up as we go along.
Were there any other questions from the commissioners? No?
I'm good.
Commissioner Torres?
So when we either have a vaccine or we reach a point where we don't need to use the Midtown as a shelter anymore, who is planning for a place for the people there to have permanent housing? What are we doing about that, and who's coordinating? What's happening with that?
So Commissioner Torres, the short answer is we don't know yet, but the longer, more complicated answer is that by creating this governance board, we're able to work on a longer term plan while also managing the immediate operations of the shelter, because there is no how do I put this subtly? I mean, it just, there's no way in the world to put homeless people back out on the streets just because we ran out of money and we don't know what the next step is. So
Right.
we have 6 months of time at least to look at what is that more permanent plan. And if we're not coming up with a permanent location, then we would be coming up with permanent or longer term placements for these people.
Okay, thank you.
Thank you for that question.
Yeah.
There's no other questions from the commission. I just had a couple things. And the part about contractors being hired, does that mean that they're part of the people that have worked with the Coalition to End Homelessness before? Are they people that have, like, this is not their first rodeo? These are people and practitioners that have been in the sector and would know how to be part of, like, they would know what to do.
Madam Chair, that's a great question. That's the most logical outcome, because the coalition will be taking the lead on advertising for the positions and recruiting them. But on the city level, Regina Wheeler, who's an engineer, has been running this. And she, you know, as she points out, I'm an engineer, I'm not a social worker. So, but she has the aptitude for it. So we talked a lot about that. Like in our job description, we took out some of the emphasis on credentials and we really focused on the aptitude. So do you have the ability, do you have past experience managing really complex situations in, and preferably in a social services setting with homeless people? But it doesn't, you know, we just felt like the right people to do this are just going to be the right people to do it, not necessarily a social worker affiliated with a certain agency.
Okay. And that would be funneled through the coalition, the job description, the promoting it, the interviews, our HR department will not be part of that process?
No.
Good, good. The other part I was gonna ask about, these timelines, I know that they are, in terms of the public outreach, that they're kind of these, I don't know, it's just fill in the blanks kind of thing, but it does say that we do certain things to promote, or that people know we're doing this, and that we are, I'm trying to find the page, but
It's in more than one page.
yeah. So it talks about internet outreach and electric copy posted.
Yeah, I think it starts on page 16.
Yes, 17 I have. Yes, 16 and 17, but the actual matrix, it says the newspaper ad is announcing it and public meeting, and it describes that. But in the target of outreach, it says minorities, non-English speaking persons. And so I'm wondering if during this time, and just in general, these newspaper articles aren't in Spanish, so how are we targeting Spanish speakers?
Chair Villarreal, I probably need to change that because this, like you said, it's comes out of the template, the plan templates. You just check boxes, and most of the time we do a Spanish language announcement. And in some years past, we've also translated at least the executive summary into Spanish. We were just moving so quickly that I was going to miss that. If I missed the first deadline, it was going to put the entire process back at least 2 or 3 weeks. And I felt like this is not ideal by far, but we just need to get it done. So unfortunately, it will not be bilingual.
So I guess if we're trying to expedite the process and we have this language about target outreach, maybe we should change it then. I know you said you didn't want to make changes for some of the other sections because you'll be doing it later on for the next iteration of this document. But then it's like misleading saying we're doing things. So does that mean maybe we should just take the target outreach out and just be more general?
Madam Chair, we could do that easily. It was pre-populated from the prior year.
Right.
So yeah, we could do that.
And I'm wondering if there's any, maybe hearing from the other commissioners, if there is any need in some way, knowing what it takes, like for newspaper ads, for example, or anything that we need to do. If we're announcing this, it's federal funding, basically accepting it. Is there anything we should be communicating out there that we need to do? I'm just asking because I'm not thinking like this is something we need public input per se, but I'm just covering bases. Does anyone feel like there's anything else we need to be cautious of in terms of the outreach for this amendment? Okay, just checking.
I just have a comment.
Go ahead.
I think it's important for all community members to know of things that the city is doing on their behalf. Things that will have an impact on not only the quality of their life, but on availability of services. They may not need them right now, but there might be a point when they end up at the Midtown campus and they need to know that the city is making an effort to make that available to all citizens. So in a way, I think that it is important that we do something. It can be minor, small, in terms of information being released. It could be, I don't know, on the counselors' websites or pages or emails that they send, but I think there has to be something in Spanish, at least for the South Side and some other that can be posted somewhere, you know, I don't know.
I think that makes sense. I guess I suggest that, like, since you said we would put it on the city website and Facebook page, that we ask our PIO to do a translation of the press release. Because I think it deserves a press release. It's important. We're bringing in this funding and this is what we're using it for. And it's very important to share, like what Commissioner Torres said, that we're doing this and it's, you know, we actually have stimulus money that's helping with this cause and that we're trying to expedite it, and just have that in Spanish and have, I'm blanking on Lilia to be able to, I don't know if she then takes charge of that if we need it translated.
Madam Chair, I don't know, but we can, because we do have a little bit more time. The first deadline comes up very quickly. So for the advertisement, but we do have a little bit more time. We could hire, we do have funds, we have administrative funds, so we could hire somebody to translate the press release for sure.
Okay, and what it is, that I think that would be helpful,
Yeah.
just to cover our bases considering the expedited process.
Mm-hmm. And if I also, oh,
Sure.
sorry.
Go ahead.
If I could also respond to Commissioner Torres's point, right now, information about this program, well, there's two things. The other staff that's actually much more knowledgeable about how the actual operations are working, they will be making a presentation at the June 10th council meeting to talk to the council about it. So I'm guessing Daniel Chacon will be there and he'll be listening. So there will be some sort of coverage. But the other point is that on the city's website, if you click that you need help and you get routed into the Unite Us platform, which is the database system for triage for people who need help, they fill out their name and then they get contacted by staff and referred to the agency that can help them. So this shelter operation is part of that referral network. But you are right in that we're not necessarily advertising it as available to the broader community. And maybe we will start doing that. I'm not entirely sure. I think initially there were some worries that we couldn't quite handle a whole flood of people until we figured out sort of how it was going to work. And I think we're much farther along that road of feeling confident that we can handle more people. There is a limit, of course, because there's only so many bedrooms, but I think your point is well taken, that people certainly don't know how to get there if they need to, unless another agency is bringing them.
So in this case, it's more about, it's not necessarily letting people know about the service, but that we are providing this, we're utilizing federal funds to be able to support this cause.
Mm-hmm.
But it's still important to have Spanish speakers know that we're doing this and that the city has, you know, we do some good things once in a while. Anyway, okay, so thank you for that. And if we could just change those target outreach and just make it like broad community or with Spanish, I don't know, whatever you all think would be easier, but it just seems pretty just quick to make changes in those boxes.
I have one more question. if I
Sure.
could.
Commissioner Lopez has had her hand up for a while.
Sorry, I'm sorry, Commissioner Lopez.
I think that this, I mean, you know, now that I'm retired, I don't follow stuff so closely. So I didn't even know the city was doing this. And I think it's a great story, that this is a good story, not only for the local newspapers, but for television, for the television news. It seems to me that that would be something the information office might want to go after.
In
Bigger
terms of,
stories about it, because it's a great story. It has human interest. It has, you know, good use of federal funds, local government getting on top of it right away and doing a really good job of it. And you're ready to take more people into the project. So it seems to me it's a great story, but
yeah, I agree.
who knows what they'll do with it. if anything.
They did a general story about how we're utilizing the dorms for this purpose. And now that we have funding coming down or being available, I think that could be another follow-up story. But yeah, it depends on who wants to pick it up. But I think that if we do have the PIO do a press release and do it in both English and Spanish, that'll be helpful.
Mm-hmm.
Do
Okay,
you have any
thank
more?
you.
Sure, thank you. Commissioner Torres?
Well, the question, Alex, was about the other survey, the survey for affordable housing. How many people responded to that survey? Do you know off the top of your head?
Commissioner
Not the
Torres,
city.
are you? Oh,
Not the city survey, but the one that your office put out before the city survey?
so the survey for the 2020
plan.
plan.
Yeah.
Yeah, before we knew all of this was going to be happening.
Right.
Off the top of my head, Tony, you may remember the exact number. It wasn't very many, but I think it was 30, 27,
27. It
27.
was 27.
And was there anything that was significant or important from that survey in terms of the plan?
Commissioner Torres, in general, people were really supportive, actually. So it was almost a good educational exercise because I think people who took it thought, oh, wow, I didn't know that all of this is happening in the community because, so it seemed most comments were quite supportive and the priorities that were funded were quite well supported. If you look back at the plan, we have a little summary of what the survey results were in that. And I think people took, we had other boxes on everything. So some people took advantage of that to talk specifically about what was going on with them. And some of it was relevant and some of it wasn't.
Okay. Thank
But
you.
we were also able to respond to a couple of people because at the last minute we put in something about if your income's been affected by the pandemic and you need help with housing, food, health, please fill this out. And so we had, well, actually, Tony, you responded to them. Did we have 2 people fill it out?
Yeah, there was 2 persons that we responded to with that specific need. So then we reached out to them and make sure that we, whatever assistance that we can help them navigate to, we set that up.
Okay, great. Thanks.
Great, thank you. And the other thing is funding this particular funding you said was for health impacts. So it wasn't necessarily anything we could be using for rent subsidy support or rental assistance, right?
Let me see. The only place where it seemed, now again, it's really hard to find all of the information in one place because it's HUD. So it looked like public housing organizations could use it to supplement rental assistance. It didn't look like it was easy for an entitlement community to do that. And because the rental assistance through HUD is limited in both time and dollar amount, I think we're better off not using it. And it creates a compliance burden for each and every time somebody's helped versus using it this way. We're only having to document the actual true operating costs.
Okay, just checking. I don't have any other questions. Are there any other questions or comments by the commission? Seeing none, what's the pleasure of the commission?
Move approval.
Second.
We have a motion by Commissioner Lopez, a second by Commissioner Torres. Any other discussion? Seeing none, can I get a roll call?
Chair Renee Villarreal,
Yes.
Commissioner Rosario Torres,
Yes.
Commissioner Ken Hughes,
You're on mute.
Commissioner Ken Hughes.
Yes.
Oh, thank you. Commissioner John Padilla,
That would be a yes.
Commissioner Carla Lopez,
Yes.
Commissioner Willie Marcus,
Yes.
motion passes.
Thank you. And thank you, Alex and Tony, for putting this together and dealing with the bureaucracy of HUD. But I'm happy that we are able to get funding, federal funding, despite the fact that we are overlooked as a city for federal stimulus funds in general. So I think we'll move on to items from the commission. Any items from our members?
Nope.
Nope,
No?
none here.
None here.
Nope.
I think maybe I think I want to ask Alex to just maybe say some things about how, not to put you on the spot, but if there's anything that we should know about as it relates to our budget deficit. And if you all have been reading the paper, we're projecting $100 million deficit in the next fiscal year. And I wanted to talk to or hear from Alex to see if there's anything we should know about that you all will be impacted. We know there'll be issues that impact you and also possibly the CDC, but also funding that we were expecting as it relates, this is my thing, rental assistance. And if we were able to move all that funding to nonprofit partners to administer, and that if there's something that is going to affect us for that pot of money that we had that would support that cause.
Madam Chair, obviously, we don't know what is going to happen next year with HUD's budget, so we may get quite a bit less in CDBG next year. But for this year, those contracts will be funded in full. Our Affordable Housing Trust Fund contracts will be funded in full. What we had done in order to provide the most support is that we had moved 2 of the rental assistance projects into the general fund, because it seems impossible that just such a short time ago, nobody had any idea that this was a situation we were going to be in. So I did not cut them. When I was directed to cut my general fund budget, I did not cut them. It will become a policy decision for the governing body to make. So that is where the priority setting will have to happen. The other big chunk of the general fund, obviously all the discretionary stuff, travel and all that stuff was taken out. I reduced the home ownership services contracts down to the bare minimum. They are required by code because to administer the inclusionary zoning program, I need to have the nonprofits income certify the buyers and work with the developers to get their homes sold, basically, by creating mortgage-ready buyers. So I absolutely needed that core service provided, but we had also, over the years, created a performance-based metric so that for every closing, so every time either the agencies got a buyer to a closing or a refinance or home repair loan or a reverse mortgage, like anytime they sort of finished and got somebody the financial assistance they needed or the financial action that they needed to either stay housed or get housing, we would give them $1,000 per person. So that became part of the reimbursement. It was this performance-based metric that we were using. So that's gone, but we are still providing we still need to pay them for the core service. So that will be another item. And we'll see how it goes, because I don't, the finance people are not, I wish I could be presenting my budget to all of you because you would understand it, but they're not quite, they kept telling me I had to reduce everything, the grant funds and everything by 20% because that was what they thought the fiscal projections were going to look like for the industry. So for land use development and real estate. And I kept saying, no, it's cash. We've got the money. It's not based on future revenues. And so we've been kind of going around and around. So I'm expecting that misunderstanding to pop up again at some point, but I feel lucky you know, the economic development people, most of their funding has had to get just slashed because it is based on a GRT revenue estimation. They have some funding that comes from land leases and land sales, but they, you know, and we're lucky that ours is set up the way it is for now. Next year, it may be a really different story.
I'm asking just because there's been some confusion for some departments that get federal funding in different pots that help pay for salaries and others. And I don't think finance, like you said, always knows the nuances to it, and that we can't just cut them, because then we don't, for one, our programming gets cut and it affects other community work that's happening, but it also, we end up, in some cases, not in CDC's case or CDBG funds, but we don't, if there's a staff cut, there's less funding that comes to us. And so there's other kind of weird nuances. So I just wanted to make sure that we aren't falling into that category. What was the rental assistance amount that went into the general fund again?
240,000.
But that was funding that we got from HUD, right? I mean, that's from the Affordable Housing Trust, isn't it?
The RFP was for the trust fund, but what we did, because we had a part of our general fund set aside for rental assistance, was that we just moved those projects into the general fund side to be able to fund in full the other Affordable Housing Trust Fund projects, because
right,
it seemed very elegant at the time. You know, I want to spend this much on rental assistance, and here are two great viable programs that are recommended for funding, so we'll just fund them this way. So we'll see how it goes.
So do you feel like they're already counting that as part of like something that is part of the funding that could get cut?
The grantees of the funding, you mean? Or
Well,
the
the 240,000 finance, do you feel like that they are looking at that as potential revenue for us? Not necessarily money that's going to go out for rental assistance?
it's certainly on the table to be cut.
Okay. Does anyone have any questions about that, or how that works, or?
I do. So what you're saying is they just took a chunk of money and it's going to go elsewhere from us. Is that too simplified? Because they have to?
Commissioner Lopez, we don't know yet. So we haven't even begun the budget hearings yet. So my job is, whoops, to knock my headset off my head. My job is to convince the finance staff that this reflects a citywide priority, something we want to support. But at the end of the day, it's the governing body and the finance committee who will say yes or no to it. You know, and it's not a huge amount of money, so it's not going to make the difference for anything else necessarily, but it makes a huge difference for this activity. So I'm trying to kind of create that as the basis of my rationale for not even beginning with a cut for those programs.
Right. If we're not doing any affordable housing projects or have no ability to fund that, then this to me is like one example that we can actually do something that supports people to keep them in homes. And so I will be advocating for that. The problem is we don't really know like when this is going to take place. We have a budget that we submitted. We basically, just so you know, we have a placeholder for DFA, and it's the same budget that we had proposed this last fiscal year, and it's just holding a space. It doesn't mean it's going to happen, and it's certainly not going to be the numbers that we're looking at. But in July, then we have to go back and actually start doing budget hearings at that point. But until then, staff has been asked to look at ways to cut. In some cases, it sounded like 40%, but I don't know exactly who and who's been affected by that. They haven't broken it down for us on that granular level. And so we just get things in piecemeal. It's very frustrating. And at the same time, it's not really always finance's fault, because things come very slow in terms of like what we know we have. revenue sources. And it's because we get GRT numbers and updates on our revenue 2 months late from the state.
Mhm.
And I may be repeating what most of you already know, but I'm just saying that that's been a really frustrating way to try to determine and look at trends. There's no way to do that. It's like we're in uncharted territory and there's nothing really guiding us. So just wanted to let you know.
But
Your hand up,
Because, can I?
Commissioner Lopez and then Commissioner Torres.
I mean, 100 million, I was thinking, oh, I mean, it's going to be police and fire and not a whole lot else. And I mean, my heart goes out to you, and I hope you can get us some, what is it, down payment assistance, or what is it, rental assistance, this money we're talking about? And geez, but that's huge, 100 million.
Yes,
Good luck.
it's unfathomable.
Right.
Torres. You're on mute.
The comment is that with the city employee furloughs and salary cuts, the amount of people that potentially could become homeless and that would potentially need rental assistance or mortgage assistance is going to go up. It's not going to go down. And, that's something that we really have to remember. We're asking city employees, especially the lower tiers, the lower salaries, to take the brunt of this. And so we just have to keep that in mind.
Absolutely. And just so you know, that furlough process was painful. The next round is probably going to be, they heard us pretty loud and clear, those of us that didn't vote for the furloughs, that unfortunately, since if we're going to have to do any cuts or any adjustments, it's going to be at the top salaries. And we're trying to figure that out, what that's going to look like right now.
I hope so. Yeah, because I mean, that's already stressing families to the brink.
Right. Agreed. Well, that's all I have. Are there any other questions or comments from commission? Seeing none. The only thing I want to say is our next meeting date, just so we can have it on our calendar. Are we going to have, I'm like, not even sure what month we're in. Okay, June, we're in June now.
I don't even know the year, so don't ask me.
So July.
Yeah, so we would not have a June meeting. We'll keep the July meeting on the books. Usually we don't have a July meeting just because there's not a lot going on, but we might have a lot going on. So we'll keep that one on the books for now.
Okay, so just for clarity, the June 17th, the regularly scheduled one, we normally have, since we had this one, we're not going to have that, correct, Alex?
Correct.
You can take that off your calendar. And then the next one that's scheduled is for July 15th. That's the week we start budget hearings. So
Maybe.
we'll see how that goes.
We'll see.
I mean, we'll still have our meeting, but I'll probably come from a budget hearing into this meeting if we have this meeting.
So we should hold it July 15th then.
Yes,
Okay.
please. Until further notice. All right. And I mean, I could talk forever. I miss you all, seeing you in person. I hate Zoom meetings, but if there's questions, I know we haven't followed up just because of the nature of what's been happening with the pandemic, but new members and putting that out there. That was the only other question I had, Alex, about updates on that. If you could tell us or send us the next, like what we're planning on doing for membership, since we do have expired terms, and then we also have a vacancy, I thought. No vacancy.
No.
Are we promoting that, our positions, or like I guess we can figure this out, but I don't feel like we have a clear pathway for this.
So, Madam Chair, typically what we will do is we do a press release to announce that there are availabilities, because everybody except for you and Commissioner Torres, I think, are serving expired terms. So it's sort of a call for interest, and people who are interested send in their resumes. And so there's no requirement to accept any of the resumes, but it's an option to just see who's out there.
As well as interest from the rest of the commissioners if they still want to serve.
Yeah, commissioners who still want to serve, submit a letter saying, I would like to continue serving at your pleasure.
And the time, you know, it's like, I know we don't meet all the time, but it is a commitment, and we all have busy lives, and who wants to be on Zoom meetings all the time anyway? But hopefully we'll get back to personal, like in-person meetings sometime in the near future. But if, just think about that, and when we put that out, then I think everybody would just have to submit that you're interested to continue serving.
Do you know about when that letter of interest would be required?
Usually it's required as you approach your expiration date, but everyone's so far over that we could just say, we could just pick a date and say, if you're interested, submit a letter, and we're also going to release
Okay.
an announcement and see.
Could you just kind of give us some direction on that, or let us know when our terms expire or have expired? That would be helpful.
Commissioner Padilla, I will send out the term list, the membership list. It has everybody's term on it. And then, I'm happy to create a template letter if you want to just be able to fill it out. That's fine too.
Okay.
I'm just looking, I noticed that I sent a letter to the mayor on February 20th asking to be reappointed, and haven't heard.
I guess you're just coming to the meetings now, Ken, without, for fun. I'm just kidding. I think I think it just dropped off because we ended up not having meetings due to the pandemic. And then CDC was an exception, not right away though. I don't know. I don't take that personally. I think it's just.
Oh, I don't. I'm just letting you know.
Okay. Did you copy us on that, Ken?
I can, sure.
Okay. So Alex can have it. Commissioner Torres?
It's not related to the commission, but it's related to city government. The channel 28, you know how you put the meetings on there? It's not coming through with sound. If I go to YouTube, I can hear any of the meetings, but on channel 28, you can see, those Zoom squares and all of that, but there is no sound.
For council meetings?
For council meetings or committee meetings. So I don't know if that's something that.
I think council meetings are the only ones.
Related to.
Yeah, council meetings are the only ones that are televised, and then all the other committee meetings have been on YouTube council meetings are on YouTube and the channel.
Right.
And committee meetings are just on the YouTube. But can you let me know next week we have a council meeting? If you watch it, can you just message me if it's not working so I can let them know?
Okay, because I mean, it runs, continuously for a while until there's a new one. And I haven't been able to pick it up with sound.
Oh, so the old ones that are running now don't have sound?
Right.
Oh, okay.
So, and I don't know what that's a function of. I know it's not my TV because I can hear all the other channels. So, I don't know, it's weird.
Can you hear other meetings happening on that channel though? Like, because school board has their meetings and some other ones, I think.
Right. Yeah. I'll check.
Okay. Let me know. Why don't you just get back to me on that and I'll let Joe know. All right,
Okay.
y'all. I appreciate everyone and please.
1 minute, Madam Chair.
Sorry.
Real quick, could you give me a call back right after you hang up, please?
Sure.
If you don't mind.
I'd be happy to.
Okay, thank you.
All right, y'all.
Thanks,
well.
everyone.
Take care.
Bye.